So Invisalign is a clear aligner system that's designed to straighten your teeth. So it's a type of orthodontic appliance. What you do is you essentially wear it all day, all night, change it every week, and then at the end of however many aligners you need, your teeth will be straight. So the good thing about Invisalign is the fact that you won't actually see it that much when you wear it throughout the day. If you've got a job that's public facing, if you speak to a lot of customers, things like that, where you maybe don't want to show metal in your teeth, Invisalign is a great solution because it's a clear aligner. You can see your teeth through it. It's very discreet. It's very easy to sort of wear. You get used to it very quickly, and it's a brilliant, honestly. So many patients do, and they love it. So Invisalign has numerous benefits. One of the main ones is obviously within the name, Invisalign. It's invisible, right? It's almost invisible. It's a clear aligner that you wear around the teeth. Sometimes in some treatment plans, in most treatment plans actually, we want a bit more predictability. And the good thing about Invisalign is, just like normal braces, we can actually put things on the teeth that will allow the teeth to move a bit more efficiently. And these are called composite attachments. Now, good thing about those over traditional braces is that these are tooth colored. So even with those on, even if they're on the front teeth, they're not as noticeable. Other benefits include, so even though the composite attachments are on the teeth, you're wearing the plastic over it, the aligner over the top, so it doesn't rub on the lips like traditional braces would if you've got metal. I've had them, so I know how it feels. In terms of cleansability as well, so there's no wires in the way. You don't have to spend 10-15 minutes trying to get every little bit of every bit of your lunch or dinner out of the gaps between the teeth. With Invisalign, it's very easy to clean. You get a nice case with it as well that you can carry it around with you. It's very easily accessible, and actually managing the aligners, it's very clear and comprehensive, so we'll tell you exactly when to change your aligners as well. The good thing about Invisalign as well is that because we take a 3D scan at the start, we can actually see how everything will look at the end before you've even started your treatment. So we make like a 3D bespoke treatment plan that we show you before we actually get started, show you exactly where the buttons go, where we need to create space if we have to, and in the end, how beautifully straight the teeth will look. So it's really, really good. So many patients, they get brilliant results in the Invisalign. With the technology that Invisalign's got nowadays as well, the variety of cases that we can treat. Before it might have been a bit limited, but now we can see so many cases. Like I've treated underbites, I've treated overbites, you name it. It's doable with Invisalign. The process of the treatment is very seamless. So what we normally start with is we do a health check. So we check, are there any cavities in the teeth? Are the gums healthy? In some cases, we may need to do a bit of work before we get started. But once everything's nice and healthy, then we take a 3D scan, we take some photos as well, and then we start planning your case. That normally takes a few days to a couple of weeks. And then we can actually, like I said, show you how the teeth will look before and after, exactly where we need to put composite attachments, where we need to create space. And at that stage, if there's any changes that you need to make, we can actually make those as well. So everything's very bespoke. 2 identical sets of teeth never look the same on the same person, so we make sure that we do look at every single element, the lips, the eyes, the rest of the face, and we'll make sure that it's tailored to the patient. In terms of once we've got the treatment plan, then normally after about a week we book you in for the aligner fits, which is when we put all the composite attachments on, we create any space, we'll talk to you about how to use it, how to incorporate it within your day-to-day activities. So finally, once the treatment is all done, what we do is, again, we'll take a scan to make sure that we've got a nice final scan of the teeth before we make your final retainers. We take the attachments off, we polish the teeth, make sure that everything's nice and clean, all the cement is off, and then we'll take some final photos, give you your retainers a week after that, and then we'll just monitor it long term to make sure that the teeth are healthy and then they remain straight. Invisalign results can range from so many different cases. So if some patients, like I said, they've got an underbite and we need to correct that, and then we can actually make the teeth overlap properly and look straight. You can get some patients' teeth are slightly bigger, some patients' teeth are slightly smaller. So it's very bespoke, and but what we can guarantee is that the teeth will be nice and straight, and then the bite will be settled. The good thing about Invisalign is, like we mentioned, is that we can clean the teeth very easily. There's no wires in the way, there's no areas for food to get trapped. It's essentially cleaning your teeth like you normally would, and then just making sure that the retainer is kept clean as well. In terms of getting the teeth straight, once the teeth are straight, it's easier to clean. around those teeth naturally anyway, because when you've got overlap, what ends up happening is plaque gets trapped around it. Especially you see it in a lot of patients that are on the lower front teeth where there's a bit of overlap. It's very hard to clean that. You end up with a lot of plaque and needing to sort of get that cleaned off every 6 months, and in some cases it can lead to gum disease. Whereas once the teeth are straight, you've actually got very easy access. You can clean the teeth very well. Plaque won't build up as readily, and you'll get a really good, healthy, straight set of teeth for the rest of your life. Invisalign can also make you feel more confident because it is something that is quite discreet. You don't see it as much when you're talking, when you're speaking, when you're smiling in photos. It can just give you more confidence day to day. There's a lot of patients that don't want metal showing, and the reason why they're getting the Invisalign is because they want their teeth to be really nice and straight. And by adding metal to that process, some patients they're not quite as confident with that, whereas with Invisalign we get rid of all of that, and we actually keep it very discreet. You can carry on about your day-to-day as normal, whatever job you're in, whatever you do day-to-day, and it will just improve your confidence not only through treatment, but once the teeth are straight, you'll have a smile that you can show off anywhere you want. So this is a case that we completed a few months ago. So this gentleman came into the practice not very confident about his smile. He wasn't really sort of too keen on smiling in photos, and he had his wedding coming up after a year. So he wanted to make sure that he had the confidence to smile in the photos. It's, like I said, it's one of the most happy days of your life, right? So you want to make sure that he's smiling in photos. So we had a discussion about what we could achieve. And then once we sort of went through everything, we proceeded with it. We decided to close the gap that he's got at the front and also align the top and bottom teeth to bring it all together. Now with Invisalign, we also do whitening at the end normally. Once the teeth are straight, we want to make sure they're really nice and white, especially for a day like a wedding, for example. We managed to do some whitening at the end, which only takes a couple of weeks. And then now he's at his wedding, and photos came out brilliant. He showed us some of them, and he had a beaming smile, which is what we wanted to achieve at the start, and he's got his confidence back.